Hi, caregivers. Thank you very much for clicking on this link. Hopefully, you'll learn a little bit about caregiving in this short video, and hopefully, you'll sign up for my online caregiving course. This course is named Caregiving Made Easy for Persons with Memory Loss, Less Stressful, Less Costly Caregiving Situation. My name is Carlos Herrera, MD. I have 38 years' experience teaching patients and their families how to care for their loved ones and for nurses how to care for their patients. I will transform your situation from a high stress, no help, no plan, too costly, to a hopeful situation where there's no stress, care team in place, a plan for assessment and treatment, and reduce costs. You will be able to save thousands. Here's a caregiver transformation story. I had one patient that she refused to eat, wouldn't take a bath, wouldn't take her medicines. The daughter's very frustrated. She explained all the logic. This is why you need to take your medicine. This is why you need to eat. You need nutrition. It's making you weak. It's making you more depressed. You need to eat. You need to take a bath for good hygiene. She explained over and over the logic of this, but it doesn't work. Sometimes you have to use fun things, sometimes use distraction to help the elderly take good bath habits. So after trying a few things, the caregiver picked dancing because the patient liked dancing before. So she would dance a little bit with the patient, and then she would give her a spoon of eggs and dance a little bit more and then give her a spoon of eggs. I know this sounds ridiculous, but sometimes you need distractions. Sometimes you need a hopeful, cheerful situation. She did the same thing with the bath. Dance a little bit toward a few steps to the bathroom. Dance a little bit, a few more steps to the bathroom. She didn't tell her mother that we're going to take a bath. Just dance, dance. Then she finally gets into the bathroom and then gives her a bath. Not every day, but it was 3 days a week, which is a lot better than before. She wouldn't take her medicine. Same thing. Dance a little bit, give her one pill. Dance a little bit, give her one pill. And this helped the situation. My name is Carlos R. Herrera. I'm a graduate of Harvard Medical School. I've been board certified in internal medicine and practicing for 38 years, educating patients and their families about caregiving. I created this course because day after day I see families frustrated, trying to help their mother. Sometimes it's overnight. They get a stroke overnight, can't walk. So they have to scramble to find help. I see them frustrated, crying, very upset, can't afford the treatments, don't know what to do. So this course, I set it up. I researched all the material I could in the internet and on books. I condensed it so it's easier for you to understand, easier for you to implement. What are the major problems in caregiving? The memory loss person has poor health habits, like won't take the medicine, won't bathe, won't quit driving, smoking. So these you can use logic, but sometimes you need distractions. Sometimes you need a cheerful situation used, some type of distraction. Photographs of grandchildren, dancing, walking, singing, whatever the loved one did before that they enjoyed in their previous life. You need to avoid caregiver burnout. I see this so often. No, they get no sleep, they're stressed out, they're using logic all day long, they have to repeat themselves so many times a day, and it gets very frustrating. The caregiver burns out, and the elderly person gets worse because the caregiver is not taking care of them. So that's why we need to set up a caregiver team, sometimes a neighbor, sometimes the family, sometimes you have to pay for someone, sometimes the government will help get a caregiver, sometimes home health. Other problems, the treatments cost too much. So we have a website, you can get cheaper medications. You need to avoid high copay situations like the emergency room. The caregiver doesn't know where to start. So we have a plan to make an assessment to rank the patient's problems in highest order, like blood pressure is the highest, nutrition is lower than the blood pressure control. The person with memory loss is getting worse, more memory loss, more falling, higher blood pressure. So we need to implement a plan to prevent these complications and worsening. The caregiver needs to formulate this plan in order to prevent the complications. Here's what this caregiving course will help for. Part 1. It will help you do a health assessment. This is so important. Does the patient have diabetes, high blood pressure, stroke, memory problems? What's the cause of the memory problems? Is it malnutrition? Is it depression? Is it other problems? Once you make a health assessment, we have sheets to help you with this. Sheets to give to the doctor, to give to the emergency room doctor, to give to the physical therapist, to help you come up with a health assessment. Then you have a plan. We have sheets for that also. Monitor the blood pressure every day. Feed the patient 6 times a day, just 1 spoonful, 6 times a day. Push fluids. And you need to learn the skills to carry out the plan. Oxygen test for the finger, blood pressure. Assess the groin in case the patient's incontinent. Assess the groin for wound care, ulcers. We give you a sheet on how to determine if you should send the person to the emergency room or call the doctor for help. Part 2 of how this course will help you, caregiver, self-care. You need to take care of yourself. The stronger the caregiver, the stronger the patient. How do you create a care team? How to get neighbors involved, family members involved. Sometimes the family members don't want to help. How to lower costs by saving thousands of dollars, avoid emergency room, use websites that reduce the medicine costs. We give you all the assessment tools, references for books and internet resources. So, which situation do you choose? A situation where there's too much stress, no plan, don't know where to start, too much cost, or a hopeful, more happy situation where it's stress-free, assessment and a plan is in place, a care team is helping you, you're saving thousands of dollars, and there's optimism for the future. Thank you much for listening. Please click on the button below to sign up for my course. Thank you.